And to address that travel question that somebody asked before, I know Megan answered it from a Department of Health point of view. There are no current travel restrictions anywhere under Pennsylvania orders. Obviously, CDC guidance is to discourage travel. But the one thing employees are aware if they're going to travel internationally, that is the one place, if people are going to travel internationally by plane, at least as of right now, they have to have a negative test to come back into the country. And so employees should be aware, and I'm seeing this anecdotally, at least on social media, some people are traveling and then they test positive and they're getting stuck in the countries that they're in. So people should be aware of that that's a possibility when they travel. So something to keep in mind. But as far as having the kind of travel policies that we were talking about last year, I don't think that you can justify it given what's going on with the CDC guidance and the state guidance. Something to think about, and that's personal travel, but something to think about with regard to business travel. We as the employer still have the obligation to provide a safe workplace, and I think that includes putting our folks on a plane. So you really need to think about, who do I want to be putting on a plane to go travel? What's it going to look like when they get there? Should I only be sending fully vaccinated people? So those are things to be thinking about from an employer's point of view. But I did want to touch on this last week. I try to repeat things at least twice for those who might miss a week. The ARPA COBRA subsidy, the Department of Labor did issue FAQs on this. And I know somebody asked a question last week and I had a little bit of a brain cramp there. The COBRA subsidy is only for involuntary terminations. Okay, this is a 100% subsidy to qualifying employees, and their families if they have an involuntary loss of employment between April 1st of this year and September 30th of this year. So basically what happens is the employee can elect COBRA. It's free to the employee. The employee does not have to pay. The employer essentially pays and then gets it back on a tax credit. So administratively, that's much easier than the employee paying and the employee getting reimbursed. We know sometimes employees don't have, COBRA can be expensive. Employees don't always have the ability to outlay that money. So again, no premiums for that 6-month period. And there is a notice, a sample notice in with the FAQs, and we'll provide that link. We provided it last week and we'll provide it again for the FAQs after this. All right, so another thing that the CDC has put out, something to think about as you try to encourage vaccination in your workplace, there is the voluntary extension of the Families First Coronavirus Response Act, right? You can do some paid time off that would now include to get a vaccine or to recover from side effects of a vaccine. You also can make a choice, even if you don't want to follow FFCRA, that we're going to give people time off to go get vaccinated. We're going to give people an extra PTO day to recover from vaccine side effects. But this is what the CDC is saying. So you can take a look at this and see how you might want to incorporate this into what you're doing. Obviously, the CDC, Department of Health, all public health experts want employers to sort of get into this and encourage their employees to get vaccinated as soon as possible, and to have employees consider scheduling their vaccines for when they have some time off for the next day or two. We're not hearing a lot about side effects for the first dose, but some folks at least are having side effects on the second dose, and that usually lasts a day or two. So if you have weekends off, consider getting vaccinated on a Friday or Saturday. If you do different type of shift work, maybe you have time off during the week, consider getting the vaccine then. And as an employer, if you're helping your employees get their vaccines, or if you're encouraging them to get vaccines, talk to them about maybe trying to stagger their vaccination schedules. So everybody's not getting vaccinated on the same day, right? It would be really difficult from an employer's point of view, from an operations point of view, if we had 6 employees in a department, all 6 get their second dose on a Wednesday and nobody can come to work on Thursday. So something to think about. And then also post-vaccine considerations. Some of the concern is, okay, my employees been vaccinated. They are having an adverse reaction, but is it really an adverse reaction? Could it be COVID? What do I do? So the first thing is, again, as part of your education campaign as an employer, you're trying to encourage people to get the vaccine. You're telling them it's safe and effective, but you also should help them understand that there could be side effects and what to do about the side effects. Make sure they understand that it's still possible to get COVID or to develop COVID even after you've been vaccinated. So we are seeing, Megan talked about some of those breakthrough cases, but what we're seeing also is you might get your vaccine. I have a friend who got the J&J vaccine on a Wednesday. By the weekend, he had developed COVID. So he clearly had been exposed before the vaccine had a chance to do its job. So that's happening as well. So make sure your employees understand that and that they know the options for testing. And again, you know, to the extent that you as the employer can offer those options for employees to stay home, to take time off to get vaccinated, to take time off to recover from vaccination, and to take time off when they think they might have COVID, that's extremely helpful. So your employee starts to develop. If any of those symptoms are consistent with COVID, we all know what those signs and symptoms are now: the cough, the shortness of breath, et cetera, exclude them from the workplace pending evaluation by a healthcare provider for the potential causes, including possibly COVID, as appropriate. And then depending on that result, you follow the CDC guidance on returning that person to the workplace. But if the employee has signs or symptoms that could be COVID or maybe could be something else, if the employees meet the following criteria, they can come to work, they feel well enough and are willing to work, they don't have a fever, they don't have the other signs and symptoms of COVID, those folks can come to work. If their symptoms don't improve in 2 days, exclude them from work and recommend COVID testing. And employees with fever should ideally be excluded from the workplace pending further evaluation, including consideration for COVID testing, okay? So some things to think about as you're hopefully going through a situation where more and more of your employees are getting vaccinated. So I have one, I'm going to switch gears on my topic a little bit, but Kevin, do we have vaccine questions coming through or COVID questions coming through?
I'm just trying to take a look here. Someone asked, we have an updated travel policy.
I have not updated the travel policy because I don't think that you can exclude people. You can have the same kind of restrictions you had last year when the state was specifically saying, if you travel to these states, you have to quarantine when you come back. But what you may want to do is have your employees tell you if they're going out of the country, and make sure that they're aware of the restrictions of coming back into the country.
Okay. There is a New York question, and I haven't seen this one, but I guess under New York law, there is non-PTO paid time off to 8 hours to receive the vaccination. Does an employer have to pay it if the employee goes on a non-work day?
So I don't know enough about the New York law to answer that question, but it's something we can look at and try to have an answer next week.
Okay.
Okay.
And then someone said, how does the employee apply for the ARPA credit?
I would talk to your financial folks, talk to your healthcare provider, talk to your financial people. They're going to have that answer for you. I assume it's fairly straightforward. It's probably a tax issue.
Okay, I think that's it.
Okay, and I just wanted to cover one other thing, a DEI question or issue. As you've all probably been following, the Derek Chauvin trial is wrapping up, or I think closing arguments were given today or yesterday. This is the trial for the death of George Floyd out in Minnesota. Many cities and states are on high alert, bringing in National Guard, including in Philadelphia. And I think no matter what happens, I think we're likely to see demonstrations, and hopefully those will be peaceful. But for those of you who lived through the 90s and the Rodney King situation, we saw what happened in LA after that verdict came down. So I think this is an opportunity for employers to have difficult conversations with their employees. And I know this is talk about your difficult conversations, right? But really, no matter what happens, I think you're going to have some people in your workplace who are going to want to know what you have to say on this. And so again, it's not the easiest of conversations. You have heard, if you've been on these town halls, you know we have a DEI team, Sienna Williams, one of the other employment attorneys at MEA, Margaret Urich, who heads our training group. They both are available to talk to you, to help you through what to do about these conversations. So feel free to reach out directly to them, or if you don't know how to get to them, reach out a hotline and they can connect you. That's all that I have for this week.
I think there's one more question.
Okay.
Can an employer elect FFCRA only for someone who has adverse reactions to vaccine without all the other provisions?
You know, it's a great question. We've had this question a lot. Can we, pick and choose the pieces of FFCRA that we want to enforce now that it's purely voluntary. What I've seen people do is say, we're going to do the emergency paid sick leave. We're not going to do the extended FMLA. And I think that's probably okay, even though we've gotten no guidance from the Department of Labor on that. I worry a little bit more about parsing out this, but not that. But I can't tell you for sure that it's a problem for you to do that. And what I would say instead is, if that's what you want to do, don't call it FFCRA. Just say, we're going to give, an extra PTO day to anybody who needs it to recover from your symptoms. That would be my recommendation.
And someone asked, can staff ask if others have been vaccinated before returning to work? So I think that's the issue we've been talking about today.
Yes, the new frontier, right? The next question is, well, so you as the employer, you've heard me say this before, you as the employer can ask who's been vaccinated. You can collect vaccination cards, keep those confidential. You can even, I think it's probably fine based on everything we know, to say, hey, we've reached 75% of our who's been vaccinated and who has not. Probably not the best idea, at least not right now. I had one member, and I thought it was great. They wanted to celebrate the people who've been vaccinated by giving them an I've been vaccinated buttons. And on the one hand, I love that. But on the other hand, I think, first of all, it potentially is releasing people's confidential medical information. That's arguable, whether vaccination information is that. But the other thing that's doing, it's probably opening up a can of worms that you don't want to open. This is it's a charged subject, the vaccination subject. There are some people who feel very, very strongly about not getting vaccinated. And so I think you might make your folks targets for harassment if we start differentiating between who's been vaccinated and who has not. However, I think if you want to give confidence to your employee base that, we're doing our part, I would track it, and I would give, percentages. Yes, 75% of us have been vaccinated, or whatever it is. And I've even seen one member, I don't know exactly what they're planning to do, but they're going to do some sort of a celebration when they get to the 75% mark. So it's something to think about. Like, you could incentivize people, give out a little gift when everybody reaches the 75%, have an ice cream truck come when you reach 75%, something like that.
Yeah, and someone asked the question, if everyone's vaccinated, do they have to require mask wearing? And again, as you heard Megan say, under the CDC, those rules have not come out yet to change that requirement.
Yeah, Pennsylvania has not changed. CDC has not changed. Pennsylvania has not changed. Now, I know on the one hand, you're saying, well, CDC says, vaccinated people can be around other vaccinated people. But for now, in the workplace, masks are still required in Pennsylvania.
Okay, and I think you asked last week, there hasn't been an updated poster for the ARPA, right? Instead of FFCRA. I have not seen an updated poster. DOL seems to have fallen asleep with this one. So bigger fish to fry. Exactly. All righty. Well, chock-filled day. Thank you all for joining us. And as I said, next week we'll hear from Amy again, as well as outside law firm to discuss union in this year. Thanks very much. Have a great week, everybody.